Virtual Reality in Mental Health Therapy by Jennifer Nguyen, Bio 241Z01, March 15th, 2026. Today, I will be speaking about VR, also known as virtual reality, and how it is up and coming and a new tool used to improve therapy outcomes. Mental health conditions are a major public health concern all around the world. Traditionally, these conditions are treated through psychotherapy, medications, or a combination of both. However, advancements in technology are now creating new ways to support mental health treatments. One of these important tools is also known as virtual reality therapy. This allows therapists to stimulate real-world experiences in a safe digital environment. This approach can help patients engage more actively in therapy and may improve treatment outcomes. So, what even is VR therapy? VR therapy uses computer-generated environments that stimulate real-world scenarios. Patients typically wear a VR headset, can visually and sometimes even physically immerse themselves into that specific environment. During the session, the therapist has full control and monitors what the patient experiences in the virtual world. These environments can stimulate situations that may be difficult or even impossible to recreate in a traditional therapy session. Some examples would be flying an airplane, or speaking in front of a crowd, or even more traumatic situations. How does VR therapy work? During VR therapy sessions, the patient is placed inside a digital environment that feels realistic and interactive. The therapist can monitor the patient's responses and gradually adjust the intensity of the scenario within their limits. For example, if someone is afraid of public speaking, the therapist may start a small virtual audience and slowly increase the size of the crowd. This process allows patients to practice coping skills and practice relaxation or breathing techniques while facing their own fears. Different types of VR therapy. There are several ways VR can be used in therapy. One of the most common is exposure therapy. This is where patients are gradually exposed to the situations that they fear. Another method combines VR with cognitive behavioral therapy, which focuses on identifying and changing negative thoughts on patterns. And lastly, another example would be VR can be used for relaxation and mindfulness exercises. This is where patients experience calm environments such as forests, beaches, and peaceful landscapes to help reduce stress and anxiety. Exposure therapy is particularly effective to treating phobias and anxiety disorders. With this VR technology, therapists can recreate situations such as flying an airplane, standing on a tall building, or even speaking in front of a crowd, like I mentioned earlier. The key advantage is that these experiences can be carefully controlled and repeated multiple times. By gradually increasing the intensity of the scenario, patients can slowly build confidence, tolerance, and reduce their fear of responses over time. There are various mental health conditions treated by virtual reality therapy. Researchers have studied that VR therapy for many different mental health conditions has shown promising results. Some of the examples would be anxiety disorders and specific phobias. Individuals with PTSD are placed in controlled environments that can help patients process traumatic memories in a safe setting. Additionally, VR therapy has been explored for depression, social anxiety, and even autism spectrum disorders by helping them practice social interactions. Virtual reality therapy offers several important benefits. One of the biggest advantages is that it provides a safe and controlled environment where patients can face challenging situations without real-world risks. These simulations can be highly realistic, which helps trigger emotional responses necessary for therapy. This therapy also tends to increase patient engagement because of the immersive experience that therapy sessions are more interactive and interesting. Accessibility and future potentials is another advantage of VR therapy. This gives the ability to expand access to mental health care. In the future, VR technology can be used alongside telehealth services to allow patients to participate in therapy sessions from home. As the technology becomes more affordable and widely available, more patients and clinics may begin integrating VR into their treatment programs. Researchers and clinicians are continuing to explore how VR can improve mental health outcomes. Unfortunately, there are limitations and challenges that come with VR therapy currently. VR equipment can be expensive. This can limit the availability in some healthcare settings. Therapists are also needed to be trained properly to use and manage the technology. Some individuals may experience motion sickness or discomfort while using VR sets. Additionally, although research results are promising, scientists are still studying long-term effectiveness of VR therapy. As we integrate with traditional therapy with VR technology, it is important to note that VR therapy is not meant to replace the actual traditional mental health treatments. Instead, it works best when combined with established therapeutic methods such as cognitive behavioral therapy. Therapists have an essential role in guiding the treatment processes and helping patients interpret their experiences during their VR sessions. The future of VR in mental health. Experts believe that VR therapy will continue to evolve. As technology improves, therapists may be able to create highly personalized virtual environments tailored to each patient's needs. Virtual therapy may also become more integrated with remote therapy services. This will allow people in rural or underserved areas to receive specialized treatments. Although continued research will help determine how VR can best support mental health care, it is a growing process. To wrap this all up, virtual reality is becoming an important tool in modern mental health therapy. It allows therapists to create immersive environments where patients can safely confront fears and practice coping strategies. Although the technology is still developing and new, research suggests that VR therapy can be highly effective for conditions such as anxiety disorders, PTSD, phobias, and other disorders. As this technology continues to improve, VR will likely become an increasingly common part of mental health treatment. And these are my references. Thank you so much for listening.